Hello everyone. So as we have already discussed different type of abortion, now we will see the short summary of this comparative discussion about the different type of abortion. First one, that is threatened abortion. What are the symptoms? There is vaginal bleeding is present. Bleeding is more prominent than pain, and in uterine size correspond with gestational age because there is no loss of product of conception. It's still inside uterus, so it's correspond with gestational age. And the cervix external os is closed. The ultrasonography shows fetus is alive. The retroplacental hemorrhage might be there, and the management is conservative management. And it is inevitable pregnancy abortion. Inevitable abortion. The vaginal bleeding is present. There is pelvic pain, and the uterine size is same. Usually it is same, and it might be smaller too, but it is usually corresponding with gestational age. It both have the same character, and the external os is open with palpable conceptors, and the fetus is often dead, and retroplacental hemorrhage is there, and the resuscitation of the patient followed by evacuation should be done. And in incomplete abortion, the vaginal bleeding is present, that may it be heavy, and there is uterine size is smaller, the cervix is open, the external os is open, the echogenic product of a conception may be there in the ultrasonography, and the evacuation uterus is to be done. And in the complete abortion, the vaginal bleeding might be trace or absent, and the uterine size is smaller than period of gestation, the cervix is closed, the external os is closed, the uterine cavity is empty, and there is no active intervention is needed. In the mixed abortion, the vaginal bleeding is trace, brownish in color, it is smaller than the period gestation, the external os is closed, the blighted ovum of fetus without cardiac activity, and the evacuation of the uterus is done as a treatment. Finally, we have septic abortion, where the vaginal discharge is prevalent, Paul speculum with feature of sepsis, and it may be the variable, uterine size may be variable, and the cervix is open, the echogenic product of conception is retained, presence of foreign body is there, and free fluid in the peritoneal cavity or pouch of Douglas. The antibiotic and the evacuation should be done to remove the septic focus. So that is all.